Hello friends, a lot of our patients ask us, Doctor, what is the correct time and position to start sexual activity after lumbar disc herniation surgery? Hi, I am Dr. Himanshu Tyagi, Head of Spine and Orthopedic Surgery at Fortis Hospital, Delhi NCR. And today we'll be talking about how and when to resume your sexual activity after your lumbar disc herniation surgery. Normally at our center, we do this surgery using endoscopic or microscopic technique, in which we do not cut any bone, we do not cut any muscle, and we remove only that part of the disc that is causing trouble and pressing onto the nerve. So normally for the first 3 to 4 weeks, we ask our patients not to get involved into sexual activities. After 3 weeks, if the patient is comfortable, there is no back pain, there is no pain traveling down the leg, there is no sciatica, there is no numbness tingling in the leg, then we allow our patients to start sexual activities. In that also there are certain rules. First of all, whenever you are starting your sexual activity after your disc herniation surgery, you should not do it on a hard surface. That means you should not do it on a floor or over a floor mat. It should always be done on the bed with a proper mattress. Also, some amount of warm-up is always required and you should not do it in your cold body. Some amount of warm-up is required. The room should be adequately warm. Also, you should avoid sudden jerky movements. Any movement that involves rocking of the spine forward or backward or any twisting movement should definitely be avoided. When the person is 3 weeks post disc herniation surgery, normally the position that we recommend is the lateral position or the side position, also known as the spoon position. This is the best and the most patient-friendly position to start, because in this the spine remains in the neutral alignment and there is minimum strain on the back. When the patient is comfortable, say around 4 weeks or 5 weeks after the disc surgery, we ask the person to change the position to patient on the back or partner on the top position. Partner on the top position means that the patient is lying flat on the bed and the other partner is coming on the top. When the patient is getting involved in sexual activity by this position, then of course pillow should be placed below the knees. There should be adequate support for the lumbar spine. If required, pillows can be placed adjacent to the spine or the pelvis so that the back is well supported and also the knees are well supported during this position. Also, excessive jerk or thrusting should be avoided during this position also. When the patient is 5 or 6 weeks down the line, then of course activities in sitting position can be tried, but during that position also the back should be very well supported. Few activities or few positions that should always be avoided are hyperextension positions like in doggy style, or deep bending position or deep twisting position should definitely be avoided. Also, deep thrusting position should always be avoided. So the practical tips are: first, start for a small duration in spoon position with proper warm-up. If at all you are not comfortable after your first sexual encounter, then you should definitely meet your doctor, ask for pain medicines or ask for proper guidance. Friends, I hope this video was useful to you. If you have any other queries, feel free to visit your operating surgeon or you can come to us. We'll be happy to help you out. All the best.